Health Minister Dr Joe Phaahla says 14 million more people have to be vaccinated by December in order to reach their goal of 70% of vaccinated people. Dr Phaahla is on a visit around Durban to round up the Vooma Vaccination Weekend program. The initiative serves as a platform to intensify the national effort on the vaccination program. Now, let's discuss the very latest on COVID-19 related news. We also joined via Zoom by Epidemiologist Dr Jo Barnes. Dr. Barnes, thank you so much for your time this afternoon.
Good afternoon to you and to the viewers.
Now, Dr. Barnes, the country is largely out of the third wave and we've now moved back to level 1. How important is it to get to that 70% goal of vaccinating 14 million people, more people, in fact, by December, and of course, the possible consequence of not reaching that number?
I'm really so concerned that people will think that when we downgrade to a lower level, that the risk is over. In fact, it's now more important than ever for us to vaccinate as fast as possible so that we don't get known as one of the countries where a lot of dangerous variants start appearing. We need to get this under control. And for that to happen, we need to convince the vaccine hesitant people that vaccination is not only in their own personal interest, but in the interest of everybody around them.
Now, Doctor, South Africa has had a number of variants that it's had to deal with as the virus continues to mutate. With the fourth wave looming and gatherings allowed in the country, larger gatherings, I might say, how likely are we to see this country having to deal with another variant? I mean, just today, some big pharma saying that another vaccine formula may have to be developed by mid-2022 to protect against future mutations.
If it continues as it had in the past, then we are certainly somewhere along the line due for another variant. Whether it originated with us in our country or somebody brought it in is really academic. If we get a new variant that is as dangerous as the ones we've got, or even more so, then we will have to step up our vaccine programs. And it may yet be that a new variant, wherever it came from, will need a new vaccine. So as soon as we can get people adapted to the fact that they need to get a vaccine, and that will keep us safe and allow us to return to normal life, the better. We are not helped in that exercise by the anti-vaxxers.
Now, Doctor, according to your professional opinion, I mean, we also heard from the Health Minister, Dr Phaahla, saying that he is confident that the trajectory that we are going as it relates to this program is on a good stead. Where are your comfort levels? How are we doing really as a country?
My comfort levels would be greatly enhanced if we could go faster. I am so concerned that we are not progressing as fast. And I'm not pointing fingers really, because, you know, South Africa faces a lot of hurdles. We've got a large proportion of our people are poor. It's not easy to reach many people in South Africa, and we are facing periodic vaccine shortages, but we don't have any at the moment. So I'm truly hoping that they can step up the education campaigns, not only the vaccination campaigns, and talk to people so that they understand, that they're not so fearful, so that fewer people die, fewer people get desperately ill, so that we can return to what would go in the future for normal.
You mentioned two things that I'd actually like the third conversation to go around, and that's communication as well as hesitancy. Now, whilst there are heightened efforts by government to increase vaccination, especially during the weekends and also ahead of the government elections, much of the vaccine hesitancy is also as a result of fear. I mean, as an epidemiologist, how should the messaging be shifted to appeal to all those who would like to vaccinate, but due to comorbidities and other reasons, they are simply afraid to do so. Is there enough information out there that talks about the safety and the efficacy of the vaccination?
If we analyze people's opinions, there's what's in front, what they say, and then there's the emotion behind it. And the emotion behind it is a mix of distrust and fear. And we need to not only address them on the wrong facts they are holding on to, but we need to address the mistrust and the fear. And that has not yet been done properly. To reassure, to say that if anything happens, we will be there the safety net will catch you. It is very, very small, the risk that anything will happen. Those facts are not properly, that drum is not being properly played. So I'm concerned that we put out facts there, but people will ignore it if their emotions don't let them believe.
And especially if you have to bring children into the fold. I mean, we've seen other countries, already having children as young as 2 being vaccinated. In South Africa, we're still at trial stage. But those that have vaccinated, those adults that have vaccinated and were quite comfortable to do so, are now finding themselves in a space of hesitancy, where they're saying, well, hang on, how well do we know about this vaccine as it relates to children?
It seems as if the safety profile for children are exactly the same as for grown-ups. For adults, the risk is very low. They respond very well. And I must honestly tell you, I would rather see any child be protected and with a very small risk of anything going wrong. Because if that child gets COVID, the chances are much bigger that something bad may happen to that child. So the risk of COVID is much worse than the risk of the vaccine. And we need to provide that information to parents.
Now, with the number of people that have already vaccinated, Doctor, and just looking at where we are as a country, moving back to level 1, gatherings, larger gatherings being allowed. We're going into the election in 28 days, and also there is this looming 4th wave. What are some of the considerations South Africans need to take into cognizance, especially because, as you said, we're looking at the numbers going down and there's a lot of optimism?
First of all, I have to confess to you, I cannot understand what a curfew from 12 o'clock at night until 4 o'clock in the morning has to do with a pandemic at all. It seems to serve no purpose, and that is one of the things that make people hesitant about some of the other regulations. If that looks nonsensical and no explanation is provided, then maybe some of the other things we can ignore as well. So that's one point that I'm concerned about. The other one is the massive opening up of numbers of people who can meet both indoors and outdoors. I'm not sure on which the government based that, because they're not telling us. So I'm concerned about that as well. And I'm really, really hoping that our election is not going to turn into a super spreader event, because that will damage relationships about the vaccine in the future enormously. So I have reservations, to sum it up.
Well, Dr. Barnes, not very good news. I suppose then we need to go back to, reinforcing that messaging of washing of hands, social distancing, etc. Dr. Barnes, that's all the time we have for this afternoon. Thank you so much for your time.
Pleasure.